For me, technology has a couple reasons we use it. It's not, a lot of times people will call it something very sophisticated, a toy. We only use technology that helps us do our job better, more efficiently, and it should have a benefit to the patient. Most patients would prefer efficiency if it means their appointments are not as long. I'm surprised that most of my new patients have never had what we call an intraoral photo, a very simple little camera that you put around and you can take pictures of individual teeth or multiple teeth and really show them the problems. If they can see the problem and then we can actually talk about it, then we can get to the solution. And we use it daily, just about on every patient. For me, I don't know how we could practice without it. And we use it routinely on all of our patients, but particular new patients. They get kind of a little tour of their mouth so that we can put it up on a screen and have that discussion. I think it creates a little more of a two-way conversation, so you're not top down, you're not telling people what to do. You know, I always let my patients know that we're just making suggestions for treatment. We're going to decide, and the only person that's going to allow this to move forward is if they feel comfortable with the recommendation, and it's for their benefit. One of our first questions is when the patient is having a procedure done, are there any questions about what we're doing today? And most of my patients know why they're here, but occasionally somebody will go, no, I'm not really sure. And I'm like, well, let's talk about that. And we usually will pull up those photos because they've already been taken, and if for some reason they haven't, we'll take one right then and there, have that discussion so that the patient just feels more comfortable. We've implemented over the last couple of years guided biofilm therapy. That's referred to as GBT. It's a new way to clean teeth. It's a little more sophisticated. It uses warm water and I won't say a really abrasive particle, but a particle in the water that's heated to help just thoroughly clean all the plaque, or what we call now biofilm, off teeth. If most people that have had their teeth cleaned, remember at the end you get a choice of mint or cinnamon or pina colada prophy paste, which is kind of gritty, and that is designed to help remove all the bacteria that the hygienist has been unable to get at the beginning of the cleaning by just using hand instruments. This is a much gentler technique which uses more flushing with water and complete removal of the bacteria, and reduces the use of the hand instruments, which people sometimes have said, are you going to have to scrape on my teeth? And you know, we try to always, we don't use scraping. We want to say we're gently cleaning your teeth. That removes stain, makes your teeth look good, but we're also doing it from a health benefit. If somebody has inflammation and bleeding gums, you need to completely remove the biofilm to help that settle down. And this technique does it more effectively than any other technique. And it is also for dental implants, which have become commonplace in dentistry and we place in our practice. And then we maintain implants where people come to us and they've had implants in other places. This technique is really considered state of the art for gentle cleaning around implants, because when you maintain an implant, it's different than a tooth. Looks like a tooth, but it's not a tooth. And you can't approach the cleaning of that the same. It could create a problem, so the guided biofilm therapy is perfect because that's how we clean all the teeth, and implants, it's really considered the best, so it puts us in a good position to help what anybody would show up with. We've got the tools to help maintain their mouth and improve.